How did artificial joints transform raw surgery? Imagine living with constant joint pain and limited movement, feeling like your body is slowly shutting down. For many with rheumatoid arthritis, this was a harsh reality before modern surgical options changed everything. Artificial joints, also called prostheses, have truly revolutionized how we treat severe joint damage caused by rheumatoid arthritis. They offer hope when medications no longer keep the disease at bay and joints become too damaged to function normally. The story begins back in the late 1930s and 1940s when surgeons like Stephen S. Hudak started experimenting with artificial joints in animals and then in humans. By 1948, hip replacements were being performed in New York City, marking a major milestone. Before these innovations, surgeons relied on techniques like interpositional arthroplasty, where tissue was placed between joint surfaces, or excisional arthroplasty, which involved removing joint parts and leaving scar tissue. These methods provided only limited relief and often left patients with reduced mobility. The core problem that artificial joints addressed was the extensive joint destruction seen in advanced rheumatoid arthritis. When inflammation persists despite medication, it causes cartilage erosion, bone loss, and joint deformity. This damage can affect many joints, including hips, knees, wrists, shoulders, and ankles. Over time, the joint surfaces become severely worn down, leading to pain, swelling, and loss of function. At this stage, conservative treatments often no longer help, and surgery becomes the best option to restore mobility and reduce pain. Modern joint replacement surgery involves removing the damaged joint surfaces and replacing them with prosthetic components made of durable materials like metal, plastic, or ceramic. For example, a total hip replacement involves replacing both the socket and the ball of the thigh bone. These prostheses are designed to mimic natural joint movement, allowing patients to walk, climb stairs, and perform daily activities more comfortably. The goal is to relieving pain, improve joint function, and help patients regain independence. Over the past few decades, surgical techniques have become more personalized. Surgeons now carefully evaluate each patient's specific joint damage, overall health, and lifestyle to choose the best prosthetic design and surgical approach. Preoperative planning includes detailed imaging, assessment of medication use, and systemic health checks to minimize risks and optimize outcomes. This tailored approach has led to better long-term results and fewer complications. The impact on patients has been remarkable. While biological therapies have slowed disease progression for many, they cannot reverse existing joint damage. When joints are severely damaged, artificial joints provide the only way to restore function. Patients often experience significant pain relief, increased mobility, and a better quality of life. Recovery involves careful rehabilitation, physical therapy, and sometimes adjustments to activity levels, but most patients see substantial improvements within months. Despite these advances, challenges remain. Postoperative rehabilitation is crucial for success, and preventing complications like infections or prosthesis loosening requires ongoing medical care. Each patient's recovery journey is unique, and surgical teams work hard to balance the best prosthetic options with individual needs. The development of new materials and techniques continues to improve the durability and longevity of artificial joints, making them an even more effective solution for those with rheumatoid arthritis. In summary, artificial joints have transformed rheumatoid arthritis surgery from limited, often ineffective procedures into highly successful interventions. They give hope and real relief to patients who face the devastating effects of joint destruction. As always, anyone considering joint replacement should consult with their healthcare team to understand the best options for their specific situation.